Good morning, everybody. Welcome, Brandon. Thank you very much for joining us today. Appreciate you being here.
Glenn, really glad to be on your show. Thanks for having me.
Well, it's certainly my pleasure. I want to just get right to it and ask you a couple questions here because I think it's important that we kind of begin to understand your journey to doing this. But before I even ask that question, I'd like to know what is unique, powerful, and we all need to know about either your TEDx talk or your company or about you. Is there one or two things that you just find that was unique and powerful about that?
Well, I would say, the short version is somewhat what you kind of mentioned. I had that interesting background of being both clinical therapist as well as a coach, and I've got kind of both a clinical therapy degree and an MBA. So it's my version of a Reese's peanut butter cup. So it really is about figuring out how we work with people more effectively because we're human beings. We're kind of a messy bunch. And whenever you throw a bunch of people together in a room and say, go achieve something, inevitably someone's going to step on someone's toes. Someone's going to throw an elbow and bloody someone's nose. So I really work hard to help us eliminate that so we can work a little bit more smoothly together. So my TED talk is all about combating negative emotions in the workplace and about how emotions are contagious in the workplace. But I do the same kind of work when I'm working with either individual leaders or teams or organizations. So maybe that's a long answer to your question, Glenn, but I think that's probably what makes me a little bit different.
Well, now I have to ask you just based upon that, when you look at the fact that you're a therapist and have the MBA, that makes you unique. I don't think there's anybody else that I've interviewed or even seen that brings those two together. Is that something that is unique in the selling position?
I have found some folks similar, but you're right. It is somewhat unique. It tends to be folks tend to either have more of the therapy side and they do more of the clinical side, which is invaluable. You learn about people's life story. I think we can all use therapy, and we uncover some of those challenges that we've had as people and some of those hang-ups and triggers. But then I apply that specifically in the workplace, which most therapists don't do. They tend to stay away from that. They want to talk about your family of origin. Well, I do want to talk about that, but I want to talk about how we make it more effective for us to lead other folks and people. So it helps to, get uncover and underneath some of the behaviors. So, coaches focus on behaviors and behaviors are great, but sometimes we have underlying issues which create those behaviors or prevent us from behavior change. So I'm not afraid to, talk about those too.
I would just wonder because sometimes you hear, and that's mostly because someone whose leadership or business doesn't not train them, but mostly we hear that we don't want, or leaders don't want to get into that emotional, therapeutic kind of area. How do you get past that?
Well, so I had a mentor of mine years ago, so I can't take credit for this question, but one of the best questions to ask someone is, okay, so let's say nothing changes. What is that costing you? That's a
Mm.
great question, right? So you might
Yes.
have leaders that just, for whatever reason, part of their story, they just refuse to be vulnerable. Well, that might cost them trust. It might cost them the ability to empower other people. It might cost them, higher performing teams, better performing businesses. So, when you start to outline all those costs, it makes a pretty good case for, well, maybe we should do some of that work. So you could be the leader you want to be, have the business you want to have the team you want to have. So
Hmm.
it's just helping people see the need and the value for that kind of work.